during the COVID pandemic, patients who needed to go to the hospital couldn't go to the hospital because they were overcrowded with the COVID patients. And so where do they get their treatment? Nobody's connected to them. Nobody knows where to get them. So many people got substandard treatment. In our programs, we made sure that all our patients got their treatment because we were connected to the patients. And this is very critical aspect that goes beyond what we do. Well, Axios is an organization that is focused on improving access to healthcare for patients, especially patients with chronic disease. That was the mission that we had when we founded it 26 years ago, and it remains the same. Actually, the story of Axios overlaps with my story. I'm an infectious disease physician, and I worked during the HIV pandemic, HIV/AIDS. And at that time, when we found the treatment that can prevent people from dying when they have HIV/AIDS, I was at the World Health Organization, and we were looking at solutions to improve access to these medicines in low and middle income countries. That's how all started. We had a successful venture then, and we continued focusing on medications that are expensive, and medication that is for cancer and for important chronic diseases and even rare diseases. So these medications are not always covered and reimbursed, and patients need help. Of course, they need financial help, but we found over time that they need more and more help, not only financially, but also to be able to cope with the disease. From the beginning, when people get diagnosed, even before they get diagnosed, they are usually lost in the system. And then once they are diagnosed, then they need the treatment, then they need to stay on treatment, and these are sometimes difficult treatments. Yeah, I mean, one of them is obvious. When medication is discovered, we need to make sure that we can get it physically in the country. And for that, the product needs to be registered. Sometimes registration takes several years. Then the doctors need to be able to know how to prescribe them, to get used to the product. That also takes time. And sometimes, some of these medicines need special tests. And the tests may not be in the country. So these are really institutional barriers that are important for us, and that actually make the patient get lost in the system. We have cases where even for sometimes breast cancer in some countries, it takes 8 months to diagnose a woman with breast cancer. This is a very long time. With 8 months, you could change stage of the disease, and the disease could get much worse. So that's why it is very important to make sure that not only the patient, but the population as a whole know where to go to be able to get diagnosed. And when they are diagnosed, know how to get the treatment and make sure that they have the means of treatments. Our focus initially was to improve access. And, we learned over the years. I will tell you a little bit the story, how it started. Initially, we said we needed to improve access. And it started with HIV. We got a lot of donations of HIV products and a lot of donation of other products as well. But, the donation don't last long. At some point, they are not sustainable, and they are cut. So what we started looking at is a way to make these programs more sustainable. The other issue that we found was that, you give the donation for the poor patients. And with medications that are pretty costly, many people may not be poor enough to receive the donation, but also not rich enough to be able to pay for the medication. So we ended up in a situation where we had that middle class that is not poor enough to get the donation and not rich enough to pay for the treatment, and they also needed help, even if they are willing to pay maybe part of the treatment. And that's how we started looking at that sustainability and started designing programs that can help all the population, maybe in different way, doing financial assessments, looking at the means, and make sure that in the end, when the patients start the treatment, they are able to complete the treatment. Giving the full course of treatment is extremely important, because otherwise, you don't get medical benefits. We have many other programs that are commercial programs where the patient can start the treatment, maybe the first month, second month, third month, they run out of money and they stop. 3 months of treatment, especially when patient has a cancer, is not useful. They wasted their money and they didn't get the medical outcome. So it's very important for us, and that is really our driver, is that the patient get the full course of treatment. And this is how we worked on. And progressively we found that even when the patient gets the full course of treatment, we need to make sure it's not only about affordability, but sometimes the patients feel, I'm doing better, so now I can stop the treatment, I don't need it. Or I am afraid of maybe adverse event, or my neighbor told me that this medication is poison, it's not good, so I stop it. We need to continue working with the patients over the course of their treatment to make sure that they take it in a continuous way, they take it as it's prescribed, and maximize the medical benefit. Asia market is a very important market because Asia is the populous continent, and you have highly populated countries, and in these countries, and they are important for us because it's about access. In these countries, because there is a big volume, people always think that if I reduce the price, I will be able to increase the volume. But when actually the medication is complicated and very costly, this principle doesn't always work. That's why I was telling you, some people start first month, second month, third month, run out of money and stop the treatment. So it doesn't really work. But we are working with many stakeholders. I mean, we work with the government, we work certainly with the healthcare professionals, because our work starts when the doctor prescribes the medicine. This is where we start working with the patient to look for ways for them to afford the full course of treatment and to be able to stay on treatment. So that's why working with the healthcare professionals and with the doctors is extremely important. We work also with civil society, with NGOs who care about this disease, to work on it. So we work with multiple partners. And this is an important consideration. In every country we try to work with multi-stakeholders, because we feel that to really increase access, it is multi-sectoral collaboration. It's not only, us or the doctors or the patient who will be able to increase access. So strategically, yes, I mean, we are now in a number of countries like Malaysia, Thailand, Vietnam, Philippines, Indonesia, Singapore, and India, and we will be developing more and more. So it's a very important country for us, continent for us, Asia. And that's where the digital tool, I mean, we are in the area of the digital revolution, and we can't keep working the traditional way. So we have a platform where our program managers work like on all the back office aspects, but also they connect with the patient. And the patients have applications where they are connected to us. The physicians have apps for that, the pharmacist as well, because the patient needs to go to the pharmacy to get the treatment. So we have digitalized our environment to make sure that the patient is continually connected, and if they need anything, they know who to contact and where to contact. This is something that in the healthcare system, it didn't happen. It has improved with the COVID pandemic, but it's still not there. The patient, when they leave the hospital, they are on their own and they are not connected to the healthcare system, even though they need to continue working with the healthcare system to ensure that they get proper treatment. And this is a big gap. The healthcare sector has been lagging behind on digitalization. You know, the banking sector has digitalized, the trade sector has digitalized, most sectors have digitalized, even the government sector has digitalized, and we in healthcare, we're still pretty antiquated. Our hospitals are very modern, they are digitalized, but once the patient leaves the hospital, they're on their own. There is nothing that connects them. And that really was a problem with the COVID pandemic. During the COVID pandemic, patients who needed to go to the hospital couldn't go to the hospital because they were overcrowded with the COVID patients. And so where do they get their treatment? Nobody's connected to them. Nobody knows where to get them. So many people got substandard treatment. In our programs, we made sure that all our patients got their treatment because we were connected to the patients. And this is very critical aspect that goes beyond what we do. You know, we cannot do it all, but it is very important that we work with all the stakeholders to make sure that we modernize the healthcare system and we make sure that the patients are connected to the health system at all time, and they can be reached, and they can reach also the healthcare system. And so digitalization is the way we are going, but it is also the way where the whole healthcare system has to go.